And now it is my pleasure to give the floor to Irene Norstedt, Director responsible for the People Directorate with the Director General for Research and Innovation at the European Commission. It is great to have you here. The floor is yours, Irene.
Thank you very much, Monica. And dear Monica and dear Thierry, and thank you very much also to ANR for hosting us at this event. Dear Einar, Eduardo, ICPerMed Vice Chairs, Secretariat members, ICPerMed members and delegates, it's a real pleasure to see you, albeit virtually today. I really wish that we could have met in Paris, but of course, as we all know, it will not be possible this year. I hope, though, that we will be able to meet physically again very, very soon. As already been mentioned, we were quite an early mover in the European Commission when it comes to personalized medicine, and it has for many years now been one of the key areas for health research in our framework programs at the European level. It really developed from the area of genomics and other omics that were strongly supported at the end of the last century and the beginning of the current one. And it's now really encouraging to see that so many of the omics technologies that we have invested in are now becoming really routine tools in life sciences research and also increasingly in medical practice, such as, for example, the MammaPrint breast cancer recurrence test. It's also very interesting to note that about 1/3 of all new therapies and companion diagnostics approved by FDA are now for personalized medicine, and this trend is increasing. Of course, in Europe and the European Medicines Agency, the situation is similar, with a very high number of the medicines approved targeting stratified patient cohorts. But as you know, personalized medicine is not just about developing medicines limited to omics. Nowadays, personalized medicine is also a much wider concept, including huge volumes of information gathered around the individual, his or her environment, gender, or medical history. It unites knowledge from a wide variety of high-throughput technologies with data from patient records, environment and social context, and it utilizes data analytics and artificial intelligence to extract patterns to identify optimal treatments for individual patients. Importantly, it also is increasingly used for prevention, early diagnosis and reduction of harmful side effects. It's widely regarded as the medicine of the future, a future that already has started in several disease areas such as cancer. A powerful example of personalized medicine beyond chronic diseases is shown by the COVID-19 pandemic, demonstrating that individual responses to infections matter. Consequently, there will be an interest in investigating further how personalized medicine approaches could improve the management of infectious diseases and comorbidities linked to the infections. I'm really looking forward to hear more about this further on in this conference. Europe, with its advanced and inclusive health systems, organized reimbursement, top-notch science in relevant field, unique cohorts and established infrastructures, has an excellent opportunity to become a world leader in personalized medicine. Not only will this improve the quality of the life of citizens and rationalize healthcare expenditures, but also create opportunities for businesses in areas like data handling, surgery, medical imaging, robotics devices, and minimally invasive treatments, to name a few. As already mentioned, 10 years ago in 2011, we at the Commission organized the first conference on personalized medicine in Brussels. And one of the outcomes was also the starting point for establishing ICPerMed. We started to work very closely with the member states and to discuss the priority setting and what needed to be done. And at our conference in 2016, we really formally established ICPerMed. And it was then established as a member states-led initiative. We do, however, continue to be very committed to ICPerMed, and we participate, as you know, regularly as observers in all the actions, and we are also continuing to support the actions with several coordination and support actions, for example, to foster international and regional cooperation, health economics, clinical trial models, standardizations, etc. And I'm really, really happy to see how ICPerMed took take over the baton from us in the Commission to really hold the flag very high and to drive the agenda of personalized medicine. And I think that the conference in Berlin in 2018 really showed how far we have come since 2011, and looking forward to hear even more about today how far we have come in the last 2 years, because as we know, science moves fast, and it will be really fascinating to see. The objective of the work of ICPerMed Consortium has been, among other things, to discuss, agree and prioritize for member states and the Commission, along with its international partners, in the domain of personalized medicine, its implementation in healthcare systems, and to direct future orientations. Furthermore, to harmonize and standardize definitions and understanding in what personalized medicine is about and how it can revolutionize healthcare. As we know, we still have some way to go there, because there are still a lot of misconceptions about what personalized medicine actually is. Apart from supporting the networking of actors in the field, the Commission has over the past decade supported research and innovation projects in personalized medicine with grants actually amounting to at least 3 billion euros. That is quite the significant amount that we have invested to really move this area forward. And some examples of some recently funded projects from our program Horizon 2020 that just finished are, for example, 2 innovation procurement projects for routine use of next generation sequencing in oncology. These innovation procurements allow the public sector to stimulate innovation from the demand side and create opportunities for companies in the field. The funded projects are in the preparation phase and have announced open market consultations. I invite you to have a look at these consultations, and they will be circulated to you during this conference. Another Horizon 2020 project I want to mention is the Multiple MS project. This project develops novel personalized medicine approaches for multiple sclerosis patients. They have recruited a cohort of over 500 MS patients, which is now undergoing follow-up and data analysis. Data gathered in a retrospective cohort, e.g. genetics and metabolomics, are used for patient stratification and validated as potential biomarkers in a prospective cohort, thereby predicting the clinical course for individual patients and identifying targets for novel treatments. One promising aspect of personalized medicine is its utilization for individualized prevention, the identification of persons prone to develop a certain disease before any noticeable symptom appear. We have already several examples of the potential to do that, not least from the work done for cancer and rare diseases, but also in some subtypes of monogenic diabetes, and also in common diseases like familial hypercholesterolemia, as we heard in the last ICPerMed conference in Berlin. Earlier this month, the Commission adopted the Europe's Beating Cancer Plan. This is one of the top priorities for the current Commission under President Ursula von der Leyen. It sets out to renew Europe's commitment to cancer and addresses all aspects of cancer, from prevention and early detection to treatment and survivorship through 42 Commission-wide actions. Building on EU national and regional efforts on personalized medicine in recent years, the Cancer Plan aims to realize its potential, both for people at risk of cancer and cancer patients. The plan makes a lot of reference to personalized medicine and recognizes that it has radically changed patients' prognosis, to cite the document directly. As part of the cancer plan, the proposed Horizon Europe mission on cancer will boost research and innovation as well as evidence policies in the areas of prevention, diagnosis and treatment, quality of life and equitable access. And I'm really happy to see that Bettina Ryll, who is a member of the Cancer Mission Board, is also speaking in the next session. As the foreseen activities in the European Initiative to Understand Cancer, to study how cancers develop and identifying individuals at high risk of developing cancer, thereby facilitating personalized approaches to cancer prevention and care. I would like to propose that ICPerMed and its related projects work hand in hand with the recent initiatives under the Cancer Plan and the Cancer Mission to further the field of personalized medicine in cancer. One thing that needs careful attention on the healthcare community is, of course, the educational aspect. Current and future healthcare workers need to be made aware of the potential of personalized medicine, the skill required to make work for society and what it entails. Currently, I'm concerned that curricula for medical doctors, nurses and public health staff does not take sufficiently that into account. And it really, for example, comes to integration of medical imaging in daily healthcare. This is where a united European effort can help raising awareness for the need of designing new education programs, which in some cases might include entirely new types of jobs. Even though the delivery of healthcare and education is still the competence of national and sometimes regional authorities, the European collaboration can highlight best practices, produce innovation solutions, and help with standardizing approaches, making them a lot more efficient. Well, some fear that the request for more personalized treatment might become very expensive. It's worth noting that there can also be savings, leading to overall cost containments. But this is an area where we will need to have a lot of further work to do to convince the decision makers that this is a fact. Horizon Europe, as you know, is our new framework program for research and innovation. It will run for the 7 coming years, and although the calls are still to be finalized, it's evidence that that personalized medicine will continue to be of great importance in projects funded through Horizon Europe. Of course, this will primarily be visible under the health cluster, but of course also we see research will be funded from the European Research Council, the European Innovation Council, and of course through the Marie Sklodowska-Curie actions. So with this, I would also like to say that, of course, we foresee to continue support personalized medicine through another partnership that we hope to start in 2023. We see that this partnership, we hope, will address some of the areas I mentioned, such as education, research and innovation in personalized medicine, and of course, its implementation in the healthcare sector. And of course, we hope to co-fund this partnership together with the member states. So the work achieved so far with ICPerMed and of course the associated ICPerMed will be crucial to ensure that the partnership will be set up successfully, and we are very much looking forward to continue to work with you and to continue our journey in the coming years. Personalized medicine is important for all of us, and I hope that we will continue to work together to foster this important area. Thank you very much for your attention, and I wish you all a very good conference.
Thank you, Irene. That was really an inspiring talk, and thanks a lot for all the support you also in person are giving to the personalized medicine in general as topic. And since the first conference, as you mentioned, 2011, the first CSA-PerMed, and of course, we are all looking forward for Horizon Europe and the new possibilities the program provides to us, ICPerMed, ERA-PerMed, and also all the other initiatives, the ICPerMed family, to further foster reflection strategies and support for personalized medicine. So thanks a lot, Irene.